Hi, everybody. Today we are going to continue with our respiratory system lecture. So previously we have discussed the parts of the respiratory system, which was starting with your nose and nasal cavity, going down your pharynx and then your larynx, which is your vocal cords, going down the tube into your thoracic cavity called trachea, and then eventually it branching to two branches, which is the primary bronchi going into each lungs. And again, notice that within your lungs you have quite a few smaller branches that ensures that air reaching the whole lung. And this branching that's depicted in the picture is called the bronchial tree, which is again located inside the lungs. We have talked about the nose and nasal cavity with having three major functions: moistening the air using the mucosal lining of the nasal cavity, submucosa with the goal of warming up the air as it passes over the blood vessels, and collecting any dust particles or harmful material that is present within our environment using the nasal hair. We then move on to talk about the pharynx. We discussed that pharynx has three parts to it. We have the first part, which is associated with your nose, called nasopharynx. We have the part that's associated with your mouth, called oropharynx, and the part that is associated with your larynx, called the laryngopharynx. We talked about the fact that around your pharynx you have tonsils. These tonsils are there are actually three different types of tonsils, but for our purpose, as far as you know, that they're located on around your pharynx, and the goal of these is to fight off any infective agents called pathogens entering either through your mouth and your nose. We move on to talk about the larynx. So for larynx, a couple things. Here is the superior view of the larynx. So what you see here as these two structures, one right here and one right here, these are referred to as your vocal cords. Now, notice that in the picture below, there's two versions of these vocal cords. One when there is a gap between them, and this gap is referred to as the glottis. And when the two vocal cords are really close together with almost no gap between them, which is basically glottis is close. So why is this two positioning important for us? So imagine air is trying to come down through your air passageway, right? So air coming down, and it wants to pass between your two vocal cords. In this scenario, as it's passing through these vocal cords located right here, you want the vocal cords to be in the open position, because that allows the air to basically get in or out of your air passageway, again, allowing you to either exhale or inhale. Now, in this scenario, you see on the bottom, the two vocal cords are very close together, which basically means almost no gap is existing between the two vocal cords. So imagine, going back to the first picture, imagine air is coming up your lungs and it's trying to pass between your vocal cords. Now, as it tried to pass between the vocal cords, it basically tried to push its way between the two vocal cords, causing these two structures to vibrate. And vibration is what allows you to create sound. So if I ask you guys, during breathing, what's the position of your vocal cords? Then the answer would be open. But during the creation of sound, your vocal cords are in a position of closed. Now going down, continuing with the air passageway, you have the trachea, which is the tube that is going down your thoracic cavity or your chest cavity. Couple of important things. The surface of the trachea is covered with this tiny hair called the cilia. And the goal of the cilia is also to collect any dust particles that may be present inside the environment and wasn't caught by the nasal hair. You also have these rings, which are depicted right here as these blue structures. In reality, these rings are actually more circular. So if you look at the information, it says the wall contains searing hyaline cartilages that prevent the trachea from collapsing. So basically, your air passageway is always open. It never closes. And therefore, the way you keep that air passageway open is by embedding these searing hyaline cartilages that keep the air passageway open at all times. Another thing that you need to notice when we're looking at the trachea is located in front of the esophagus. If you're unfamiliar with the word esophagus, this is for the passage of food versus trachea for the passage of air. Now, what is the structure of the trachea in terms of the steering cartilage and then another muscle that is located behind it? So I'm gonna draw a quick picture for you right here, which is kind of again depicting the esophagus and the trachea. So if I'm showing you from the superior view, this is my trachea, and a tube that is located behind this, which is also smaller, called esophagus. Now, trachea is made up of the front of it. If you kind of highlight it, see how I'm running my finger and it forms a C? So this part of it is referred to as your C-shaped hyaline cartilage. And the back of this, I'm going to change my pen color so you guys can see this. This part right here is basically a muscle. It is a smooth muscle, which again, it means we have no control over its movement. So kind of imagine this muscle contracts. When this muscle contracts, the ends of the C comes closer together and making this air passageway smaller. So if you contract the red portion, which is the muscle, the ends of the searing cartilage comes together and makes the air passageway smaller. However, if you relax this muscle, then the ends of the searing cartilage, which is this structure, is farther apart from each other, and therefore the air passageway is wide open. Now, why do we talk about this? If you go back to the earlier slide when we're talking about trachea, notice what it says. When coughing, trachea constricts as it narrows, which means the muscle is going to contract and make the air passageway more narrow or smaller. This allows the air to move more rapidly. Basically, you're making your pipeline smaller, and therefore it allows the air to move with a higher pressure. And that allows you to basically dislodge, possibly dislodge anything that is within the trachea, which include both the mucus and debris. Now, the other thing that I want to talk to you guys about is a structure called epiglottis. Now, break down the word for yourself. Epi means on top of, right? This is something we talked about before, and glottis was the space between the, what, if you guys remember, between your vocal cords. Again, kind of reminder of what, going back, this is space we talked about, it was referred to as the glottis. So epiglottis means it sits on top of the glottis. So let's depict it in a picture. So here is my epiglottis, which is a cartilage flap, and here is it in this picture. So again, both the same structure. One is in an open position. So this is open. and one is in the closed position. So what's the difference? So imagine you are breathing air. So air comes from your nose, which is somewhere up here. Air comes down, and now it has two options, right? Now air wants to go down the trachea, which is the tube that we have in front. So the only way you can do that is by having the epiglottis, this flap, in an open position, allowing the air to go down the least resistance path, which is going to be again trachea, as it is larger and always open. Now, when we're talking about you eating food, so here is your lips, basically your teeth, food enters, which is what we depict in green. Now, food has two options right now. It can go down the esophagus, which is the tube in the back. So this is your esophagus. Sorry, I'm kind of going off the side. And the tube in front, this would be your trachea. So food gets here, it has two options. It has a wide open tube, which is the trachea, and a narrow tube in the back. Which one do you think your food wants to choose? Food says, I want to go through the less resistant route, the big one, the trachea. But you don't want the food to go down the trachea. So what happens is epiglottis, that little flap we mentioned earlier, comes over to a closed position, right? And covers the trachea. So here's your trachea, now it's completely blocked. So food passageway, the only way you can take is your esophagus, which ends in your stomach. Now understand this again. If you are eating and talking, for eating, the epiglottis wants to be closed. When you're talking, as the air wants to come out, the epiglottis is in an open position. So you know the saying that says, don't talk and eat at the same time? Is because when you do that, your body needs to pretty rapidly figure out when to open it to allow you to talk and when to close it as the food is going down. And as many people know, if you talk and eat at the same time, there's really good chance that you're gonna start to choke, because epiglottis may get it wrong, and instead of having the epiglottis as a closed position when you're eating, it opens it up, allowing the food to enter your air passageway. Now, continuing going down the trachea, again, notice the trachea is going to branch, and these branches are the ones that are going to go to your lungs. So if I was kind of drawing the line of the lungs, this is what your lungs would be. Here is your right lung, here is your left lung. Notice that trachea starts to branch, going this way and this way. Now, the immediate branching of the trachea is identified as primary bronchi. Bronchi is a plural version, so if we're talking about one, it would be bronchus. Now, kind of follow the logic. Primary becomes secondary, which basically you're going to start to form a smaller branches. So see, a smaller branches. And those branches are going to branch. That would be your tertiary bronchi, so primary, secondary, and tertiary bronchi. Bronchi becomes what we identified as bronchiole, which basically means little bronchi. And then it continues to what we identify as terminal bronchi, and eventually through other branching, it ends at what we identify as alveoli or air pockets, which is what you see here. Kind of look like a bunch of grapes packed together, right? So each of these are alveolus. If you're talking about all of them, they're called alveoli. And you can see the labeling down here. So what is the purpose of alveoli? It is the location for gas exchange. So it is extremely important in terms of what it's going to do for our ability to bring in oxygen and allow us to exchange gas between blood and your lungs. Please do note, if you go to an actual anatomy textbook, the branching we showed here is more complex, but because of the simplicity or introductory nature of the course, we only talked about some of the main branching. Now for your lungs, we actually break down the lungs to individual lobes that helps us with increasing the surface area. So again, here is the right side, here is the left side. The right side has 3 lobes. Here is 1. Here is the second. Again, this is not the best depiction, but again, you can see 3 lobes: superior, middle, inferior lobe for the right-hand side. And for the left-hand side, what we have is only 2 lobes, making it superior and inferior. Now, quick note, notice that on the left lung, we actually have this little indentation right here. This indentation is called the cardiac notch. So if you kind of imagine your heart is sitting right here. Sorry, this is not the best picture of the heart. But the apex of the heart is pushing into the left lung, and the gap or the little indentation that's created as a result of it is called the cardiac notch. Now we're going to switch gears and start talking about the concept of inhalation and exhalation. But for us to better understand that, we first need to go and discuss the double membrane layer that is found around the lungs. So for this double membrane that's found around the lungs, we use the word pleural membrane. We have what we identify as parietal and what we identify as visceral. Parietal is the outer layer, visceral is the inner layer. So the visceral, actually I just noticed this is backward. Parietal is surrounding your, or in contact with your rib cage, and visceral is in contact with your lungs. Let's take a look at the picture and see if we can process this. So the red tissue you see right here, the darkest red you see is your lung. Notice the layer that is directly peeling off your lung is known as visceral pleura, as in this is the internal lining. And the second layer, which is basically this layer coming into contact with your rib cage, so it lines the inner aspect of your rib cage, that layer is called the parietal pleura. Now, these two membranes are not in direct contact. There is actually a gap between these layers that is filled with fluid. Now, why do I need this fluid? Why do I need these double layers that is present around the line? So, and then why do I need the fluid around it? Here's how I think about it when I explain this concept. Think about you have 2 glass plates, and between these 2 glass plates, you add the smallest amount of water you can add, okay? Small amount of water. Now, if you try to grab the top plate and lift it up from the bottom one, it's going to be really difficult because that little water between the double layers, between your 2 plates, has allowed a suctioning between the plates, making it hard for you to lift the top one from the bottom one. What you can do is slide the top one off of the second one or the bottom plate, but you cannot actively pick up the top plate and easily separate it from the bottom plate. This is exactly what happens in your lung when you introduce that little amount of fluid between your visceral pleura and the parietal pleura. It allows these 2 layers to be attached together. Now, why does that matter? The lung tissue itself is very elastic, which means if it's not fully engaged, if it's not fully inflated, it will collapse inside the lung cavity or inside the thoracic cavity. So to ensure that the lung is inflated and it allows you to carry out the process of inhalation and exhalation, you have your lungs. The lung is connected to the visceral pleura, and visceral is connected to the parietal pleura. Parietal, however, is attached to what? To your rib cage. So think about it. When you inhale, what is happening is your rib cage is moving outward. So as the rib cage moving outward, your parietal pleura also moves alongside. Parietal is gonna pull what? Your visceral pleura, and visceral is gonna pull what? Your lung tissue. So, for instance, again, in inhalation, as your rib cage moves outward, your lung also moves outward, which means the volume of your lung is increasing or your lungs are expanding. Reverse that. During exhalation, your rib cage moves back inward. Now, again, through the parietal and visceral, you're also going to push the lung inward and causes the volume there of the lung to decrease. Now, it will become clear why I keep talking about the volumes in just a second as we go through the rest of the PowerPoint. So one of the main medical conditions associated with your lungs and the nature of the elastic nature of your lungs is what we identified as pneumothorax or a collapsed lung. So again, I mentioned the elasticity of the lung tissue. Now imagine the space that is filled with very little fluid under normal condition has a lot more fluid because of an infection, or because of some sort of injury or trauma, you have introduced air from outside into this space. Let's say the person has a gunshot wound or a stab wound, or a rib has broken and causes a puncture inside this space. Now, what happens when the air or extra fluid gathers within this cavity between these two membranes? The two membranes going to pull apart from each other. And because again of the elastic nature of your lungs, the lung is just gonna collapse inside the rib cage. It literally feels like a deflated balloon. And that is what we identify as a pneumothorax. It is treatable. You can remove that extra fluid, or you can remove the extra air that was introduced into the gap and allow the lung to inflate back to normal. Here's a picture of an X-ray picture of somebody with a collapsed lung. So here is, you can see kind of the grayish haze, which is basically the lung tissue. But right here, notice that the space is completely black, and you can see the lung again is collapsed inside the thoracic cavity. Please do not mistake the midsection. The midsection is basically your heart. So this light at the center, that's the heart. But notice again, this is a black versus a kind of a grayish haze. Grayish haze means the lung is fully inflated, versus the black surface means the lung has collapsed and the thoracic cavity is empty. So I'm gonna stop the lecture here and continue the rest with inhalation and exhalation as a new lecture.